If you've had a concussion and feel like you're not getting better, you're not crazy, and you're not alone. Welcome to the Brain Bros. Okay, welcome to another episode of the Brain Bros podcast. I'm Nate Pope with NCX Brain Recovery. We do a lot of brain recovery, especially with post-concussion syndrome. Today we have an awesome guest, Dr. Tom Tervort, with us. And he's a colleague and friend, and we're excited to have him here. When you're in the world of brain recovery and passionate about helping other people, I feel like it's just awesome to surround yourself with like-minded people. So Tom is one of those people. I'm going to let him introduce himself, and today we get to talk about TMS. So maybe a little introduction about your background, and then tie that into what led you to TMS and what that is.
Absolutely. Well, I appreciate it.
Yeah.
Thanks, Nate. Nate is a good friend, and I'm grateful to be surrounded by good people, just like you say. So I have a doctorate degree in nursing practice. I've been a nurse practitioner for several years. Worked in the medical field for about 20 years, and I've done a whole bunch of different things. I started out more in the cardiac world and did a lot of things with open heart recovery, and as an ICU nurse, I was very much in the cardiac ICU type treatments, and thought for sure cardiac was my identity. So you need somebody that can read an EKG. That was my thing, electrophysiology. I got to a point though where I was working so many hours and nights and weekends and holidays, and kind of wanted to get a little more of a family life work balance going on. So I decided that I would shift more into finding a job that gave me daytime hours, 9 to 5 work, which brought me into a neurosurgical clinic. Not something that was on my radar really at the time. But while I was in that neurosurgical clinic, I decided to go back to school and get my doctorate degree. Got that, started out as a nurse practitioner right in a neurosurgery clinic in the operating room every week, helping with central nervous system needs, which was a great foundational neuroscience background to get a real understanding of kind of the structure of the brain. From that point in time, I realized, okay, a lot of these surgical cases are leaving people with functional deficits, which is a big deal. When you've had a surgery that maybe saves your life, but then your quality of life is depleted because brain function is down, I kind of thought, well, maybe we need to do something to work in that field and help people regulate some of that function. And so I shifted my gears more towards a functional side of the brain. Opened up an acute concussion clinic where we treated post-surgical cases, strokes, concussions, you name it, anything that was disruptive to brain function. And also was running side by side with that some components of a post-concussion program. And really got into the trenches with that, and dementia and anything that related to the brain. Really got to where I love that. More recently, in the last few years, about 3 or so years, started ramping up into what concussion and brain injuries do from an emotional and mental health side of things, and kind of came into this space of transcranial magnetic stimulation, which has a lot of overlap with those who are dealing with concussions, especially as it relates to their emotional state and a few other things, which we'll talk a little bit about today. I really have found a love for what this treatment can do. It's a low-risk treatment that makes a big impact for brain health, emotional health, all of those things. And that's kind of where I am now. Within the last year, I kind of branched out a little more on my own to start progressing what this treatment can do and making more access for people, which is a big deal to me, is that people have access to the care that they need. So it's kind of where I am now.
That's awesome. So that's why you got into it. That's where you're at. You're doing it. Can you describe, like, what is TMS
Absolutely.
exactly,
Yeah.
and how is it like changed? And because it's been around for a while, as I understand, but it's gotten more effective. And
Yeah.
so, just tell us about that.
Absolutely. No, it's a good question. It's a lot of times I get this question. People hear the term TMS but don't really know. And that's another thing I really want to make sure is that we're educating. I want to get this information out there. If people know about it, then they know about what resources are available to them. And so I'm always a fan of explaining what TMS is. And like I said, TMS, it stands for Transcranial Magnetic Stimulation. And it's been around since really the 80s as a medical treatment. So it's not new, but the original method of treatment has kind of shifted over the last several years. It really initially started out mostly just for major depressive disorder, but we've also found in more recent years that it's very effective for other mental health needs such as anxiety or obsessive compulsive disorder or post-traumatic stress. There are a lot of things that TMS can do, and there's more research coming out now about how it can help with other things that we didn't even necessarily think about, like dementia. There's cool stuff that you can do with dementia. There's stuff with traumatic brain injuries. There's a lot that's happening with it. It's not one of those things that I like to say does everything. There have been some things that have been tried that haven't been as successful, but for the most part, if the brain can help it, it can help in some way anyway.
Sure. So what are the things it's most successful with?
So some of those that I've just mentioned have gone through FDA approval process and clearance, and that's depression, OCD, depression with anxiety. There are some for like smoking cessation, things like that. So there are some FDA clearances that have been shown to be very successful. But the main things we find that we treat are usually depression with anxiety. Those tend to be a lot of the areas where people are seeking out this treatment. And that's partly because people know that that's what this has been for since the 80s, as we were talking about. In the 80s, they came out with some protocols where you go into a clinic and you get 20, 30 minutes of treatment where we put a coil on your head and we send a magnetic pulse into the brain. That magnetic pulse in certain sequences is changing some of the function of the way that those neurons send signals to other neurons in the brain. And by changing some of that, we're able to cause the way that the brain functions in emotional regulation and then other things to shift. And so that original protocol was effective. They found that people who were maybe treatment resistant and had tried all the medications and talk therapy and other things like that and hadn't had success were having some success with TMS. So they started kind of trying to get more people who were treatment resistant to get this treatment and found that, roughly 40% of people maybe were getting some success rates with that. But the problem a lot of times was compliance, because you're asking someone to come in every day for about 2 months. I mean, Monday through Friday for 36 sessions. I mean, it's hard to carve out time like that for a couple of months. And so people would try it for a couple of weeks and then fall out or, not complete the full
they're
round.
dealing with mental health challenges. If you have depression,
sometimes the motivation to just do that is part of it.
Exactly. That makes sense.
Yeah. So they created those protocols and have been using them for a lot of years, and insurance has been covering that protocol for depression for several years. But it was more recently that some bigger study groups out there like Stanford University started looking at it and figuring there's got to be a way to more easily condense this to help people with compliance, and some other things were discovered that kind of helped us understand how effective the treatment can be when it's condensed. So some protocols were created, some studies were done, and these accelerated protocols were finding more like 80% success rates. People were responding at higher numbers. And part of that has to do with compliance as well, where people can take off a week of work, but it's harder to take off 2 months and chunks of it at a time. So the University of Toronto came out with a protocol after Stanford did, and they found that, okay, we can condense everything into 1 day if we augment the treatment with a medication that enhances some neurotransmitters in the brain. And so they created a 1-day protocol. And suddenly now we're getting these protocols that are much easier to do, shorter periods of time, and we're seeing success rates that are higher than the original protocols. And we're in those, 80-85% range reported from the studies. And now that's what we have. We have these protocols that have gone through FDA clearance processes, and we're seeing great success for people in a short period of time. We're even finding that some people don't have to go through the whole struggle of having maybe medications that they don't feel leave them with good side effects, or there are options now that you can look at as treatments that are maybe a little easier on the body, on the brain.
Oh, that's awesome. So, and I don't want to go too much into what we're doing necessarily, but we work with post-concussion syndrome, and the a little bit here and there approach for that.
And I love that.
Was not very effective.
I love that you guys have figured that out.
And so really the brain is a creature of habit. And if you do the right things in a shorter period of time, but if you do it many intervals, many repetitions, we know that, that's what forms habits and changes, brain neural pathways. And so it's kind of been cool to see, a totally different approach, a kind of a more targeted and intense approach for post-concussion syndrome has been more beneficial than like an hour a week, over a years of time and no results.
And I've worked in both spaces with that. I've worked in the acute space where you bring someone in occasionally, and because insurance will cover one visit every so often. And I've seen, some improvement for people. But the things that I've seen work really well is when you kind of have more of an intensive approach. The brain actually does a good job at responding quickly to things that are being done quickly. You think about how fast our brains work. I mean, it makes sense that they would. And I've been watching that for years as I've been working in this space with brain health. I feel like quick and intensive ways tend to be very beneficial.
Seems like if the brain can't make the shift that it needs to make to do what it needs to do, it goes into that compensatory mode. Neuroplasticity kicks in and it's adapting, but it's adapting in a way where it's trying to deal with something. And it's not getting the right kind of stimulation to engage it to do what it's capable of doing, what it's designed to do.
Absolutely.
So it's interesting. There's some overlap between the TMS treatment and post-concussion syndrome treatment.
Absolutely.
Because if you do it the right way, at least for our patients, symptoms start really decreasing, and it's because I think we're engaging neural pathways that need to be engaged, rather than giving a little bit of therapy, just enough to strengthen compensatory neural pathways that are trying to deal with the situation.
And you talk about neuroplasticity, and there's so much we can go into with neuroplasticity, because that's what this is all about, is changing the way that the brain processes information and helping that brain change. Plasticity, right? The definition of that is to change. And the brain is great at doing that, but sometimes it's doing it with what it's got. And if there's been an injury or high amounts of stress or something that has disrupted a pathway, it's going to find a way to figure it out, but that way is not necessarily always the most functional way. That's where what you guys are doing with your more intensive therapies is super beneficial. And then what TMS is doing similarly is very beneficial. We have more recently found what TMS is actually doing to the brain, where previously we kind of had an idea of some things that it was helping with, but there have been some really cool studies that have come out recently that have taught us when we send that magnetic stimulation in a concentrated way to areas of the brain, we actually are allowing parts of that neuron, if the neuron's been exposed to stress, and those dendritic spines, the little parts of the neuron that receive information or transmit information, the stress causes those to die off. The TMS can actually regrow those. We didn't know that was happening, but we can actually reestablish networks and pathways within the brain. If we are able to do that with some TMS, and then folks like you are able to come in after TMS and then use those networks that are being reestablished, well, you train those pathways to work in the ways that work best for that individual.
Right.
I think they complement each other quite a bit, but there's also a component of when someone's got a brain injury, what mental health concerns are also brought on. The stresses of not feeling like yourself, and maybe depression sets in, or feeling anxious because you could do that before, but you can't right now. Well, then we with TMS can help with those emotional regulation components, structure some neural pathways, and then you guys can help build some of those kind of networks back in. I think TMS is not a standalone treatment. I think it works best when complemented by other therapies, whether that's talk therapy or occupational therapy, or therapies that are going to help the brain reestablish those networks well.
Yeah. Well, that's so cool. So if I understand correctly, and correct me if I'm wrong, when you're increasing the dendritic connection, so we're working with patients, we're doing balance and vision and verbal auditory processing and cognitive skills, and we're trying to do a lot of whole brain activities. They're doing these things simultaneously to try to make things connect. It's all about reconnecting, because there is a disconnect with brain injury for what we're dealing with, but and we're having a ton of success doing that. But it sounds like the success would only go up if those connections were easier to be made, because there's more dendritic connection sites.
Yeah, absolutely.
Right? So
no, I agree with that. Anytime you can physiologically, help the hardware, then it's going to make it easier to use the networks, right?
Yeah.
So I think parts of doing TMS to help reestablish networks it's very important. But I think that the therapies are of equal importance.
Right.
Like I say, we can do a lot with what TMS can do. We focus more on the mental health side of things, but I mean, there's a lot of great evidence with executive function and things that the frontal lobe can do. I mean, there's some great evidence with TMS and how it relates to brain function.
Yeah, that's awesome. So awesome. So if a patient's coming to you, let's say they're either having depression, or maybe they have post-concussion syndrome. They've had a concussion and their symptoms have lingered post 1 month, and they're just in either of those situations. What's something that you would say to someone in that situation, and like, how should they think about TMS and as a possibility? And what would you say to them?
Yeah, so ultimately, I would hope that they're doing something therapeutic already. I think it's important that you start working on the brain as soon as you can, and therapies are going to be an essential part of that. I want people to be involved in that stuff right away.
Yeah.
For TMS, I feel like as things have lingered for somebody, maybe after a concussion, if one of the concerns that they're majorly having is the emotional regulation has been all over the map, then let's get you in and work on some TMS. We've got great protocols, and we've got a lot of evidence and a lot of science that say, we can support this brain injured individual by helping with that emotional regulation. So that's going to be a big part of it. I mean, you've worked with a lot of brain injured patients. It's not just balance and vision, and those are big parts of it, and you feel off, but that emotional regulation also needs to be addressed. And that's what TMS and what we do in our clinic is really focused on helping, is how can we help regulate that emotional portion.
Yeah, that's awesome. I love it when I see a patient who comes in and that shift happens for them, where they've been emotionally dysregulated.
Yeah.
And one of the things I love to hear the most is, oh my goodness, I feel like myself again.
Yeah.
Because I think there's a disconnect when you're dealing with a lot of that emotional stuff. And it's pretty, there's a lot of hope, I guess I would want anyone listening to know, is there's just a lot of hope. Life quality changes happen for the worse when you're dealing with all of this stuff, and for the better when you start to recover.
Absolutely.
I'm guessing you have experiences and you've seen patients' lives improve a lot.
Absolutely. Yes. We've seen good things. And like I say, it's a combination factor of things. I love when we collaborate in healthcare. I love when we're able to find people who do one skill really well and we do one skill and we work together and that person is getting the best possible outcome for themselves. I've seen many cases where we've had great outcomes where working together, and some cases where they've been working with someone for a while and maybe they've hit a wall and they need something else, and we work together in that way. But many instances where somebody who's maybe just been lacking motivation in their life because they've felt so down or haven't been able to function at the levels that they want. Well, I've got patients that I've treated who come back to me after a month and say, I cleaned my house for the first time in 3 years. I haven't been able to do that in 3 years, or something along those lines. That seems like a simple task that we take for granted when we're functioning well. But great success is seeing people get back into their life and their routines and patterns and habits that they once enjoyed and felt functional in. And that's what we want to do. That's what we work towards.
I love that you came from the world of structural issues, neurosurgery, et cetera, where you're like, okay, we got to take this tumor out, or we got to
get rid of that bleed, or help this spine a little, there's some stuff like that.
Yeah, sure. But eventually realized, quality of life is still impacted by the function of what just happened in that brain or what someone's dealing with.
It is.
And the functional stuff can be helped through therapies that are not the traditional kind of therapies. Maybe.
And I think that, Nate, is where the ball gets dropped in the healthcare industry. And I see it because I've worked on all sides of that. Yeah. And I see a lot of patients who super grateful that they got that tumor out, or super grateful that after they had their trauma and the fracture in the skull and the bleed was resolved and all of those kind of things, that they're alive and they're grateful to their surgeon. But the surgeon at that point typically is kind of done with what they do. And then the person is wondering, well, where do I go from here? I don't feel like myself. And that's where this kind of stuff comes in. And we need to have more access to it, more awareness of it, more people to address that. So I'm grateful for what you're doing here just to get the word out for more of this kind of treatment.
Yeah. No, I love it. A second population we've started working a lot with outside of concussion stuff has been strokes. Yeah. And they graduate from therapy when they can go to the bathroom by themselves and they can get dressed by themselves and but they're still feeling way different from pre-stroke. And they're like, wait, I'm done with therapy? What do you mean I'm done with therapy?
Right. Like, I'm not functioning at the levels I used to be. But...
And that function is what really leads to that quality of life. And so we've had a lot of them come, and almost without exception, every one of our stroke patients has made huge progress. Because the ceiling they thought that, they were at, because they graduated from the traditional therapies, was nowhere close to where they could be. Oh yeah. So it's been exciting and fun to see them find their lives and find function. And
and I love that. And that's been, like I say, there's not been enough accessibility to that treatment and that therapy. I think there's more and more people willing to do that, and I'm excited to see that there is more accessibility for that. I think it's awesome what you're doing.
Well, TMS is an amazing modality, I think people should look into. And so if someone needs to talk to you or find you, maybe now's a good time just to let them know what's the best way to get access to a consultation, and does that cost anything, or what is that?
Yeah, so for an initial consultation, we don't charge for an initial consultation. You can reach out to us find us online at optimaltms.com. We have all of our information. We've got locations across 3 different states, in Utah and Las Vegas and Nevada. So, and then we've got a location in Casper, Wyoming. So we're spread out a little bit, but it gives us a little bit of more accessibility in different areas, and intention to make it more accessible in other places in the future one day.
And you do virtual consultations.
Yeah.
If someone lives wherever, you
consult from anywhere.
Okay.
Absolutely,
Okay.
You betcha, and
Okay.
no cost for those initial visits. So be happy to.
It's an amazing service. I feel like if it's a free consult, talking to someone who's an expert and can give some guidance when they're in that.
That's
situation.
A big deal to me. Is I want to educate. My doctoral scholarly work was in patient education. If I'm not educating patients on what to expect and what this does and how it works and outcomes, and I don't think outcomes are as good if you're not well educated. So I'll spend a fair amount of time on those consults, really getting into the depths of what this is. Yeah, that's awesome. Okay, well, and as a reminder, if you're dealing with post-concussion stuff, also, our access to us is through ncxbrainrecovery.com, and you can get a free consult with us. We love the free consult concept. So far, we're not too overwhelmed with consults that we're able to still do it that way, and I think it's awesome because it's free education, and it's giving people who've maybe lost a little bit of hope a guiding, some guidance where they're needing some right there, dealing with everything. So anyway, we're now going to discuss a little bit about neuroimaging because he has some experience in that area. I'm going to let him introduce himself a little bit as far as his background with neuroimaging, and then we'll just dive right into it. Okay. Yeah. All right. Well, appreciate it. My background has a lot to do with my time in neurosurgery. As a nurse, I worked in neurosurgery for several years while I was getting my doctorate degree, finished up my doctorate degree, and worked immediately in a neurosurgical clinic in the same clinic that I was working in. Working with some really fantastic neurosurgeons where I actually had a lot of opportunity to gather information, learn from them, right? And as they, taught me what they know, and that's where I learned a lot about reading MRIs and figuring out what I'm actually seeing. Not just reading the report that the radiologist gives, but being able to actually look at the images and find diagnostic information. So I have a lot of experience with that. I've been doing that for several years. I use that in clinics that I've worked in previous to the clinic I'm in now, where I've been treating traumatic brain injuries and looking at that. A lot of central nervous system and spine imaging, and that's kind of an area I enjoy. I like to look at an image and try and figure out what's going on in the spine or the brain, or help somebody figure out what they need from that point. Okay, that's awesome. I'm more at the level of reading the paragraph at the bottom after someone's done that. And that's good too. It's important. My only qualm with that is they usually say, if there's nothing wrong, they say, unremarkable. Nothing to say here. All brains are remarkable. What are you talking about? Anyway, the unremarkable, I guess, is nothing wrong here. That's right. Yeah. Which is often what we see, actually, when someone goes to get an MRI on their brain after a concussion. You're exactly right. So, yeah, that's a pretty common thing, and I think a lot of times, as I've worked in clinics where we just treat traumatic brain injuries, concussion, we're asked that question on a regular basis. Should I be getting more imaging? I went to the hospital, we didn't get imaging. Is that okay? I think there's a lot of question about what are the guidelines and what should be done when it comes to imaging after a brain injury. Yes, help us. Go into that. That's exactly what we want to talk about. When should we go get it? I know there's like different kinds of imaging, and you could talk a little about that maybe, but also like if I'm getting an MRI, when should I get one on my neck or spine or brain? So of course there are CT scans or MRIs. Those are sometimes more of the ones people know. CT scan, MRI, X-ray. Those are all the imaging that people know. Each of those different images do certain things better than other things. And so some are more cost effective than others. And so there's a lot to consider when doing that. And if somebody goes to, say, the emergency room after they get a concussion, there's going to be some of all of that weighed into the decision by the physician or whoever's seeing that individual on should we do this or that. Typically, in a lot of cases, when somebody's dealing with a brain injury and it seems severe enough that imaging is warranted, the first image that people are probably going to consider getting is a CT scan, because it'll tell us if there's bleeding on the brain. We can see that. It's a cheaper image than going full MRI.
Okay.
So in the immediate acute phase, that's probably what you're going to see most people get.
Okay.
Is it appropriate to always get a CT scan right after a brain injury? No, not necessarily. In many cases, we're exposing you to unnecessary, radiation, things like that with a CT scan that you didn't need. And so it's good to have an evaluation immediately after with somebody who's qualified to determine should we get an image
based on
not.
your symptom severity.
Yeah, based
stuff
on
like
symptom
that?
severity.
Okay.
So if somebody comes in, to an emergency room and they're vomiting and they just had a pretty significant blow to the head, probably going to get a pretty quick image, because vomiting is a good indicator that there's something more going on here. So symptom severity is going to help determine what somebody should be getting as far as imaging is concerned. That being said, if you don't know, go get some eyes on it by a professional and make sure that you are safe, because you don't want to miss a brain bleed if that is happening. But in most cases, it's not necessary to get a full-blown CT scan.
Yeah, I know most of the concussion patients we see haven't had
an image
or haven't had a doctor recommend the imaging.
Yeah.
But I think their symptoms are more, I've got some headaches and, brain fog and dizziness or balance issues or blurry vision, but not like I'm vomiting, I have seizures, I am passing out. Or,
Yes.
those seem like...
You got blood coming out of any part of the...
so those extreme symptoms, like you kind of intuitively like, okay, these are big deal things.
Yes.
Usually.
Then those are the reasons that you're probably going to get an ordered image. But if you have, those symptoms of cognitive disruption, maybe some visual disruption, things like that, balance is off, those are sometimes things you can watch and work on, but you don't necessarily have to have an image. And that's for immediate, right after the injury. But there are also a lot of questions that are brought up about, well, I had a concussion 3 years ago and I've never had any imaging, but I've still got symptoms. Should I get a scan of my head? And that's a great question. I think in a lot of cases, sometimes getting a scan at that point is more reassuring than anything, but you're probably going to see that same unremarkable
I was interested to hear what you had to say about that, because we have that question a lot.
Yeah.
Like, this is post, 3, 4, 5 years since I had a concussion and I'm still dealing with these symptoms. Should I go get a scan? And from a therapist standpoint, I hate to be the one saying, no, don't worry about anything. You don't need a scan.
Yeah.
Because, there could be something.
There could be something.
And it's probably not a great chance that there is, but there could be. So I do like them to make that decision on their own, but be educated in doing so.
Sure.
So anyways.
And chances are likely that we won't see anything on a scan if it's been a while. But it's sometimes worth getting because you need to know. Or if the symptoms really are persistent and maybe they've increased some, then we need to probably just check to make sure. It's not required. At a certain point, it just becomes a decision that's made by the individual with a provider just to figure out what the best way to go. But we can order them at that point. Now, that's for an MRI of the brain. Because we're probably not going to see a whole lot there. there are images of, say, the cervical spine that I might recommend depending on your symptoms if it's been a while.
Right.
The spine is maybe a little bit of a different thing than what we need to consider when considering MRI of the brain for concussion. And that's because the spine, there's a lot more moving components to that. There are a lot more potential areas that are weaker than that, skull that surrounds the brain. As far as from an orthopedic standpoint, the bones and the structure there. The discs may have some herniation that occurred during that whiplash moment from the concussion. And cervical issues can be as much a contributor to concussion as anything else. And so you really got to consider the spine. If somebody's coming to you and saying, I've still got these concussion symptoms, and you can trace any of it radiating from the neck, or you can trace it back to a major whiplash component of that injury, it might be wise to get an image of the spine because there are a lot of things you can do to the spine that you don't know you need to do unless you've got an image to see what that is. And an MRI is an appropriate image for that at that point in time.
Yeah, no, just recently we had a patient that we had on the schedule. We're kind of an intensive program, as you know. So it's 7 hours a day in the clinic for usually 2 weeks, and we see symptoms get better, and it's just an awesome approach, the intensity level of what we do. And but right before we started, we started hearing more about symptoms that were a little bit different and seemed to be triggered by neck. And sure enough, that patient got a scan, and we decided, no, now's not the right time for treatment.
Let's address the neck issues and maybe an appropriate referral to a neurosurgeon or a pain management group or something like that for the neck to help work on those issues. I think that's appropriate. I think that's good.
Okay, so let's say someone does get a scan. For whatever reason, sometimes they're in a car accident and they want to make sure that there's no brain bleed because there was some head trauma, shearing forces, all of that, and so and it comes back and says actually there's nothing here, unremarkable.
Yes, unremarkable.
So there's no symptoms here, nothing to worry about, no structural issues.
Does that mean there's not a concussion then?
And they're coming to us obviously because there is issues, right? And they're like, they're often frustrated because the imaging didn't tell them what's wrong. So
it's a very common situation. Problem is you can't see concussion on any of the imaging we have. Concussion is a much more micro level injury, and when we're talking about concussion, does that mean that the effects of concussion are not present because we can't see them on an image? Not at all. Most concussions I've ever dealt with, I've found nothing on imaging. And so that's why maybe ordering a scan is unnecessary, because we just got you charged through whatever hospital we sent you to a couple $1,000s that you now have to pay for, so that we could say, oh, this is a concussion, but it's not something structural that we need to go see neurosurgery for or something like that. It's a very common thing you're describing, and it is frustrating for patients because they can't see it. Diagnostics for concussion don't come from imaging. There are some other methods of diagnostics, objective measures that we can look at, but for the most part, diagnosis comes through presentation and history. I mean, that's a big part of it.
Well, the chronology is telling. I hit my head, and now I have symptoms. I didn't have these before, and now I have them. And the funny thing to me is that same patient will go, well, I have this symptom with blurry vision, and I have some balance issues, and gosh, I'm a little depressed. And come to find out, they're going to vision therapy and physical therapy and counseling, and each one of those is saying, well, this is what's going on in their field of, and they're missing that this is post-concussion stuff
Syndrome,
that you're dealing with, post-concussion syndrome.
Yeah.
And so the chronology is telling, like, I hit my head, now I have all these symptoms. They just so happen to also be the symptoms that align with post-concussion syndrome symptoms.
Right. Right.
And I still have them post 1 month, post several months, or post years.
Yes.
And so the chronology is a big teller, I think.
Yeah.
And so I help them. And when they have the MRI and they're saying, the MRI says I'm fine, or there's no problems, but I'm not fine, I just like to help them understand structural versus functional a little bit, because structurally your brain could be totally healthy. Correct me if I'm wrong.
Yeah.
Like the tissue is getting enough blood, in other words, to be healthy brain tissue, but still the neural pathways and the way it works could have been affected by the trauma.
Sure.
Is that what we're seeing? Probably.
Yeah. So when we talk about functional components of what the brain is doing, there are ways of measuring that. I mean, we have functional MRI, which allows us to actually look at blood oxygen levels and see where they're going into parts of the brain and identify areas that maybe aren't getting sufficient amounts due to that area of neurotissue isn't calling on the blood like it's supposed to.
Right.
We can measure some of that, and I think there's a component of functional MRI being beneficial.
Yeah.
There are a lot of things that we can learn from that.
Yeah.
Again, there are, it's not always completely diagnostic, because maybe that functional MRI is picking up on something else metabolic that's going. I mean, there are processes that can influence how that MRI looks, that functional component.
Yeah.
But there are a lot of things we can learn from functional MRI as well. One thing with functional MRIs is they're typically a little bit expensive, and I don't know insurance ever covers them at all. I've never met any insurance that does. But they're a piece that can be helpful in certain treatment modalities, but we don't necessarily use them for diagnostic purposes.
Right. Okay. Yeah, and I've worked with a more of a research-based clinic in the past that did use functional MRI.
Yeah.
And
for research, it's fantastic. We can learn so much by tracking things, but you have to track things. You got to measure regularly to get some of that information. Yeah.
So, and that's the thing with when patients are improving pretty quickly with an aggressive, intensive program. I felt like, well, they're changing day 1, 2, and 3, and I've got them for 2 weeks.
Yeah.
It's impractical to do a scan on day
every
1, 2,
single
3,
day
4.
while you're going through treatment.
And I
get
really
expensive
wanna,
pretty quick.
I kind of want to target what's going on right now to be the most individualized, effective program.
Sure.
If some things have reset, let's say neural pathways that were disrupted are reconnected, but others are not yet.
Sure.
We want to target the ones that are not yet.
Yeah.
But that's kind of on a daily basis changing. So I have felt at our clinic, we don't do the functional MRIs, but we look at symptoms and performance deficits. And we look at those many times throughout every day.
Right.
Where are we at with this? On a 0 to 6 scale, where are you at with this symptom?
Right.
And how are you doing in these performance areas that we tested that we're looking at on a daily basis? And then we're able to kind of target as we go. So
absolutely.
Okay, so it's imaging has its place and is pretty awesome for providing the information that someone needs if it's the right kind of
and if it's needed at that point in time, right? And sometimes it's hard to make that decision of if it's needed or not, but talking with individuals who know some of those specifics can help. So if you do have a question about it, I would recommend connect with someone who can order those images and get them if you need them.
Sure. That's awesome. Well, I think there's just been a lot of confusion about, because there's so many types of scans and there's so many people say, oh, go get a scan.
Yeah.
That'll help you figure it out.
I hear that
and
a
then
lot.
a lot of times it doesn't tell you anything when it comes to concussion. And so it's good to have some clarity for those.
It'll rule out other things if you have concern that something else is going on.
Right.
Rule it out if you need to.
Right. Well, especially if you're worrying about it is kind of interfering with your recovery and your
Agreed.
progress.
Yeah.
Because sometimes that mental health side of just the anxiety
of not knowing, and then you get a little clarity with a picture, though it doesn't give you the details of what's going on. At least it ruled out a bigger issue that you want to address immediately or something like that.
So when it says nothing's wrong, don't let that make you more anxious.
Yes.
At that point, go talk to someone else and say, like, come to us. We'd love to talk with you. So a concussion specialist, and just say, okay, my imaging says I'm good.
Right.
But I still have all these symptoms. What's wrong with me? And we can go into...
Then you start working on treatments and things that'll help.
I think it's good news that things are good. And I tell them, no, don't think this is bad because it's not telling you what's wrong.
Right.
Think this is good because it's ruled things out.
Yes.
And it's telling you probably have a good, structurally speaking, your brain's in good shape for recovery. Yeah. We just have to figure out functionally what's going on and how to fix it.
Right.
Give it the right activities that stimulate the right parts of the brain so that it starts to engage and the function can improve.
Absolutely.
And we're not limited by some structural issue.
Right.
So be happy that it says not remarkable.
Yes.
Or unremarkable. Be happy that it says there's nothing wrong, and then move forward with the idea that just because structurally there's nothing wrong, there is some legitimate things I'm dealing with.
Right.
That many people deal with that are functional issues.
Right. And there are people that can help you work through those things.
Yeah.
So that's awesome.
Okay. Awesome. Well, thank you, Tom. I appreciate your expertise and
it's my pleasure.
Hopefully we all understand neuroimaging a little better now.
Happy to do it.
Thank you. And before we leave, tell us how people can get in touch with you, because you also work a lot with the emotional dysregulation side of post-concussion stuff, especially using TMS, which we did another video on. But let them know how they can get in touch with you.
Awesome. Yeah. So I'm part of a company called Optimal TMS, and so you can find us online at optimaltms.com. And we do a lot with the emotional health regulation. I mean, my background being in that side of the neurosciences, we realized, that's a big area that's been unaddressed, is the emotional component. So if looking for something along those lines, in our clinics we have psychiatric help as well as transcranial magnetic stimulation treatments that can be very beneficial as well.
Yeah, awesome. And even a complement to post-concussion stuff. So it's pretty great to have that modality, the TMS, available. So, also a reminder, NCXBrainRecovery.com. You can set up a free consult if you're dealing with post-concussion stuff. We'd love to hear from you. So thanks so much.